Oh, what is going on? That is huge. What's up, everyone? My name is Dr. Mo and I'm a dentist. Let's watch the removal of this humongous dental calculus dental tartar on teeth. Yeah, this is honestly one of the biggest dental tartar that I had seen in an individual tooth. Okay, so they're using an ultrasonic scaler, most probably with water cooling. Okay, so they're starting with scaling the premolar teeth. Right, so it is of course absolutely normal to see some bleeding happening. By the way, this is like a dentist view, so that's why I picked this one. Oh, look at, so this is basically the view of the inside of the lower teeth. In dental or dentistry lingo, we say lingual surface. Okay, so this is the lingual surface because it's toward the tongue, and look at how the dentist here is gradually removing all of that dental callus and tartar. And a lot of people think of dental tartar as in it's more specific or close to the gum line, which is true, but it's not only specific to it, so it can be on a lot of the tooth surface, covering a big part of the tooth surface. Oh, look at all of that tartar, and watch till the end because the dentist will get to the removal of that huge piece afterwards. Pushing a like on the video helps the video a lot at zero cost to you, and subscribing. I don't like to mention it a lot, but it helps out. Oh, we're getting close to that huge dental tartar piece at the end, and honestly, relatively, even these pieces are quite huge. So some problems with certain patients who have dental tartar or dental calculus of that size. Of course, it's our job to clean it and everything, educate the patient. My concern is, in order for dental tartar or dental calculus to get to the size, this happened over a long period of time where the patient had poor oral hygiene, perhaps wasn't brushing effectively or at a good frequency, meaning at least twice a day, and all of these things which are technically the norm. Okay, so they're getting closer to the back teeth, or we'd rather say the posterior teeth, but not yet. Looks like this is like a central lateral canine now because it's quite sharp and pointed. Then we have premolars, first premolar, second premolar, then the molar, but because they're all covered up with dental calculus, it can be a bit challenging to view. Okay, so this is cleaning that tooth really well with the ultrasonic scaler, and this is why it takes some time. So a lot of people think, okay, fine, a dental cleaning session is going to be very simple, it's not going to take a lot of time. Well, it really depends on the patient cooperation and compliance, the severity of the case. Is it simple case? Is it I would say this is more of a moderate to rather even severe. At this case, the dental calculus in tartar is almost covering all of the tooth. So you can think about it in a way that the dentist here is sort of uncovering these teeth from the dental calculus. And I'll tell you a fun fact. So just because the tooth is covered with all of that dental tartar and dental calculus does not automatically mean that that tooth has a dental cavity. So surprisingly enough, you could be removing all of that dental tartar and calculus and there may not be a cavity on it. But of course, gum disease can be there. Oh, just removing a whole lot of dental calculus. So much is there. So I used to get cases like this, especially in university, or US people would say dental school. The problem is not the severity of this for me, but at some point we were using a manual type of scaler. So scaler is this thing that the dentist here is using. This one is an ultrasonic scaler, so it's attached to some sort of device or machine to power it. The manual scaler is used, as the name clearly states, manually, and of course it takes much more time. It's more exhausting. It's, in my opinion, technique sensitive, meaning you need to have particular technique and particular way that is taught in order to do this properly. So much dental calculus. Okay, so as you can see, these two are premolars. The one before them is the canine, looks like lateral and central here. So I was going from the midline, central, lateral, canine, two premolars. This is the molar tooth, and look at all of that calculus. So the back teeth can also be prone to dental tartar and dental calculus, especially the wisdom tooth, by the way. And the reason is people, these areas may be a bit more difficult to access for certain individuals or reach while they're brushing or cleaning their teeth. Also, even if someone uses the dental floss, maybe they may be going quickly over the teeth and they're not really flossing well that wisdom tooth area. In fact, in place where I practice, in the dental clinic, I've seen a lot of cases where the wisdom tooth develops a cavity due to people potentially not flossing that region very well. Oh, some dental calculus, and the tooth is hiding underneath that. Look at also how the gums are red. There is some bleeding going on. They look inflamed. So much calculus being removed, dental calculus. We're trying to uncover that molar tooth. It's pretty insane, to be fully honest with you. So we have a suction here from the dental assistant. Can't really see well what they have there. It looks like something to retract, push away the cheek, so that the operator can have a better view of the side that they're working on. Really good so far. The operator is very detailed. They're trying to not leave anything behind. They're going over all surfaces. That's why this thing takes time. There's something also called as dental loops or magnification that a dentist, dental hygienist, or whoever who's doing the cleaning, dental scaling can wear, and that helps magnify the side that we're operating on, and to see some small dental calculus pieces so that they won't be missed. So going over the lingual surface is also really important. Going over, it's called the buccal, because toward the cheek surface, it's really important to clean it as well. And as we go further back, you can see also that last molar is also full of dental calculus. So as I said before, when you look at the tooth, there's not that many like that. There's not really big cavities or something. Of course, it would be more visible on an X-ray, but that's what I was saying before. The tooth could be covered up with dental calculus, but it does not necessarily mean that there are cavities under. There could be, and there could also be no cavities. They're starting with that last molar inside. Also, if you noticed If we go back a bit, okay, just 1 second. Looks like this patient here has some crowding because the teeth look quite misaligned. There's some teeth pushing toward the inside, some teeth pushing toward the outside. So far so good, and look at how that dental calculus goes into the grooves of the molar, and the operator here is really trying to clean all of that, and some of the dental tartar and dental calculus gets stuck into the suction. Do you see that? Just 1 second. Gets stuck into the suction, and you have another suction to remove it, and that can happen. The operator here goes to scale the buccal side and the proximal side a bit of that molar tooth, as well as the occlusal. Occlusal is that surface that we really chew and eat on, bite on. As you can see, as I said, the gums are inflamed as well, but the operator here doing a good job so far. I don't know if you notice in some areas that the dental calculus can be a bit sticky, especially the occlusal surface, although the operator is trying to, as much as he can, I guess, to remove them. Looks really good so far. I guess that's all for today. Thank you everyone for watching. I'll put a playlist. You can check out videos similar to this or other dental topic. Thank you everyone for watching. Dr. Mo Dentist out.